Welcome to Epstein Becker Green's webinar, Substance Use Disorders and Healthcare Reform. What are the key changes being considered by Congress and the Trump administration? This is the second presentation in the Substance Use Disorders Crash Course webinar series. Before we begin today's presentation, please be informed that today's webinar is being recorded and the participant phone lines will be placed on mute throughout the program. In approximately 2 to 3 business days following the webinar, Epstein Becker Green will communicate the availability of the webinar recording and access to the PowerPoint materials. We are pleased to welcome our speaker today, Jackie Selby, a member of the firm in the Healthcare and Life Sciences practice in the firm's New York office. As part of her practice, Ms. Selby negotiates agreements by and among managed care companies, insurers, hospitals, health systems, behavioral health and substance use disorder treatment providers, physicians, and ancillary providers. At this time, I'd like to turn the webinar over to Jackie Selby.
Thank you, Lisa. Good afternoon, everyone, and welcome to this installment of the webinar. As an overview of what I will cover today, first I'll provide some background on how substance use disorder services are covered by insurance today. Second, how the American Health Care Act, recently passed by the House of Representatives, would impact those services. Third, whether the Trump administration's Department of Health and Human Services is doing anything differently regarding those services. And last, how the Trump administration's budget proposal would impact those services. So as a general background, opioid addiction is a major national crisis. Over 50,000 people died from opioid-related deaths last year, and that number is expected to increase. It's the leading cause of death for persons under 50 years old. Utilization has increased and costs have increased associated with opioid-related health care. Inpatient stays increased 64% and ED visits increased 99% between 2000 and 2014. Coverage and treatment for SUD services today is governed in large part by the Affordable Care Act and a few other key laws and regulations. First, under the Affordable Care Act, essential health benefits provision is very relevant. Services for SUD, including treatment for opioid addiction, are required to be covered along with mental health benefits as an essential health benefit by individual and small group insurance plans. There are about 10 categories of essential health benefits, and that's one of them. There are prohibitions on annual and lifetime limits for any benefit that's listed as an essential health benefit, and those prohibitions on limits apply to large group plans as well as the individual and small group plans. Medicaid expansion has been, under the Affordable Care Act, has been very important for the population with SUD. As background, approximately 70 million people have Medicaid coverage today, and almost all of them are in managed care plans. There have been 32 states, including the District of Columbia, that have expanded Medicaid to childless adults with income less than 138% of the federal poverty limit. And 30% of all adults with opioid addiction get their coverage through Medicaid. The expansion coverage is required to include SUD benefits, and individuals with SUD are considered medically frail for purposes of Medicaid and are entitled to additional protections. For example, they can choose between the traditional Medicaid plan and the alternate benefit plan if that's what the state has approved. Next, the Federal Parity Law, or MAPIA, the Mental Health Parity and Addiction Equity Act, generally requires that any limits on mental health or substance use disorder benefits offered by an insurer be no more restrictive than those that are applied to medical benefits under the same plan. Parity rules also apply to Medicaid, including managed care Medicaid, with compliance required starting this coming October. Kevin Malone covered parity in more detail in last week's webinar. And next, I think the 21st Century Cures Act is worth mentioning because in a rare bipartisan measure, the act signed in December did allocate $1 billion in grant spending to treat opioid addiction specifically, and that was for the fiscal years 2017 and 2018. There are a few more Medicaid-specific rules that are relevant to substance use disorder. The Medicaid Managed Care Final Rule allows for coverage of residential services for SUD crisis management, and those services were previously subject to an exclusion, the IMD exclusion, which stands for Institution for Mental Disease. And now they're covered as in lieu of services that would be provided in an inpatient or subacute facility. Also, Medicaid 1115 demonstration waivers allow states to develop a full continuum of care for individuals with SUD, including coverage for short-term residential services that would not otherwise be covered by Medicaid. Multiple states have obtained this waiver. For example, in New York, the Medicaid HARP product covers individuals with SUD or serious mental illness. So next we'll talk about how the American Health Care Act, as passed by the House of Representatives and currently being reviewed in the Senate, would impact SUD services as they are covered today. There are some key provisions in the Act that we'll go over. First, the Act would give states the ability to request waivers from the federal government or Health and Human Services to change the list of essential health benefits, for example, to eliminate the category of mental health and SUD services for that state. States would also be able to request waivers to remove the current prohibition under the Affordable Care Act on taking pre-existing conditions into account for insurance coverage. So those with pre-existing conditions like SUD would end up paying more for insurance than those without, or they may be denied coverage altogether. In addition to the state-requested waivers, the Act would freeze Medicaid expansion in January of 2020. This means that states would only get the regular federal Medicaid match, not the enhanced 90% match, for any new enrollees after that date. The Act would also transform Medicaid overall into a capitation-based program, which means a defined contribution plan instead of a defined benefit plan. And these changes would likely force states to limit eligibility or benefits or both under Medicaid. The Congressional Budget Office estimated that 23 million people would lose insurance by the year 2026 under the AHCA as passed by the House. It said that services likely to be excluded from the essential health benefits in some states include substance abuse benefits. And I'm quoting from the report, in particular, out-of-pocket spending on maternity care, mental health, and substance abuse services could increase by thousands of dollars in a given year for non-group enrollees using those services. And moreover, the Affordable Care Act's ban on annual and lifetime limits on covered benefits would no longer apply to benefits that are not defined as essential. So the Act, interestingly, would not change at least not formally change parity requirements under MAPIA that would apply to SUD, but such parity requirements only apply if there are those benefits offered in the first place. So if SUD treatment is not a covered benefit, then the parity requirements would not apply. The U.S. Senate is now focused on reviewing the AHCA from the House and on ACA repeal overall. And there are indications that it is taking the opioid crisis into account in considering such changes, including extending the period, extending the period to unwind Medicaid expansion. Interestingly, there are a number of states, I think approximately 8, that have laws that effectively require termination of Medicaid expansion if federal financing decreases. So the extension of the unwinding period for Medicaid expansion might not matter in states that have such automatic triggers. Another change being considered is revising the pre-existing conditions waiver that is allowed by the House version. And third would be increasing tax credits for persons based on income, so at the lower income level, not based just on age. Senator Portman of Ohio, a state which has been greatly impacted by the opioid crisis, has said so many people on Medicaid and expanded Medicaid rely on that funding for treatment for substance abuse. This is clearly an issue where you don't want to make matters worse by reducing access to treatment. And Senators Collins of Maine and Cassidy of Louisiana have their own, working on their own version of the ACA repeal, would allow states to decide what to keep or not keep in the from the Affordable Care Act, but their proposed, or their version of a repeal bill would keep one benefit mandatory, and that is coverage for mental health and addiction treatment. So moving on, what is the Trump administration, through its Department of Health and Human Services, doing differently than the prior administration regarding SUD services? So far, the differences have mostly involved encouraging states to request Medicaid waivers. HHS advised states in a letter in March that it would use its Section 1115 Medicaid waiver authority to approve provisions related to training, employment, and independence. These types of provisions would affect many individuals with substance use disorder. Shortly after that letter was sent, the American Health Care Act was amended via a manager's amendment to include an option that would allow states to condition Medicaid eligibility on satisfaction of a work requirement, with some exceptions for the disabled, elderly, or pregnant adults. HHS is currently reviewing various state-requested waivers to add such work requirements, and these range from referrals to work search programs to requiring a minimum number of hours be worked per week. There are a number of other types of state Medicaid waiver requests submitted to HHS that would likely impact individuals needing SUD services, and these include drug screening requirements. Wisconsin's application, if approved, would make it the first state to require drug testing in order to get health benefits. That requirement was recently softened in their application, I believe, so that a person could agree to go right into treatment instead of going through the drug screening. And another type of waiver request involves non-emergency medical transportation. SUD treatment is one of the most frequent types of uses of such transportation, and multiple states have sought waivers to limit that benefit under Medicaid. Finally, how does President Trump's executive budget proposal impact these services? His budget proposal does include an increase in drug treatment spending by about 2%, so adding about $200 million to the $10 billion the federal government already spends. But the increase takes into account funding already approved by Congress in the 21st Century Cures Act. So actually, without that funding under the 21st Century Cures Act, there would be a cut in drug treatment spending under his budget proposal. An earlier draft of the budget also eliminated most of the Office of National Drug Control Policy's budget, but after significant backlash, it was mostly reinstated in a subsequent draft. The budget also includes proposed cuts of $400 million to the Substance Abuse and Mental Health Services Administration within HHS, major cuts to Medicaid, and cuts to various other agencies and programs that currently address drug addiction. So, in summary, there are many moving parts in both the legislative and executive branches at this time that could impact services, how SUD services are covered today. Thank you for joining, and please feel free to reach out if you have any questions.
Thank you, Jackie. Thank you, everyone, for joining. This concludes today's webinar. You are welcome to submit any questions directly to Jackie Selby at the email listed on the slide or use the phone number displayed. Again, in approximately 2 to 3 business days following the webinar, we will communicate the availability of the webinar recording and access to the PowerPoint materials. We hope you will join us for upcoming webinars in this substance use disorder series, taking place every Tuesday in June at 2 p.m. Eastern. For additional details or to watch recordings of previous webinars, please visit our website. Thank you.